Well, thanks a lot for staying with us here on Sunrise Live on E as we continue with the conversations this morning. Now, ulcerative colitis is part of a group of diseases called inflammatory bowel diseases, right? Now, its incidence is rare and affects 5 in 100,000 people. It is more common in women and usually appears between the second and fourth decade of life. So to talk more about this, we're joined in studio now by Dr. Marlin Mckay. As always, we invite you to be part of our conversation this morning. You know that Dr. Marlin Mckay is always open to take your calls, so give him a call, 011 447 1742. Alternatively 1620. Dr. Marlin, always a pleasure having you join us.
Thank you, Faith. Thank you.
What are we talking about? Ulcerative colitis. It's number one, it's a tongue twister.
Yeah. So we're talking about, as you mentioned, the broad group of conditions called inflammatory bowel diseases. If you break it up, colitis is inflammation of your colon, which is your large intestine. So that's where it is. Ulcerative meaning ulcerations or inflammation. So something goes wrong.
Does that mean sores in your...
Absolutely.
Okay, in your large intestine.
In your large colon.
Okay.
Right? So there's two main, you have Crohn's disease and ulcerative colitis. The ulcerative colitis is the one we're talking about now. So that's in a chronic disease, so it's there all the time. It affects younger people, so usually they're diagnosed before the age of 30.
Whoa.
Okay. And it presents with this abdominal pain and rectal bleeding and diarrhea.
Is this constant or constant rectal bleeding and diarrhea?
Absolutely. So it's not just the once off where you have a bad gastric flu or gastritis or enteritis and you have this. This is a chronic, and it's usually characterized by relapses. So you have a flare up and then it goes away, and then a flare up and goes away. And this has to be investigated because it's a chronic ongoing disease for which there's no cure, unfortunately.
When you're saying that there's no cure, can somebody die from it?
The actual disease can be kept under control, but there are complications. So they can develop a toxic colon with septicemia, the whole colon can swell up. They can develop cancer of the colon. They can develop bowel obstruction. So they may die from the complications of it, but not necessarily from the actual disease itself.
And why does it affect more women than it does for men?
Yeah, so if you look at the causes, number one, we don't have any direct cause. We know that something goes wrong in your immune system. So your immune system is geared to fight bacteria and viruses, but something goes wrong in your immune system attacks its own cells, and in this case, the cells lining the intestine. So that autoimmune process we talk about is usually more common in females. And then there's a genetic link as well. So someone, if there's a family history of someone in the family has it, you're also more susceptible to it. So that's where the link is, and that's where we find that more women are affected than men.
And it's so fun because it affects people, younger people, right? So when it affects younger people, what are the causes? Is it because of our lifestyle? Is it because of the way we eat? Is it, what causes it?
Yeah, so again, we don't have any one definitive cause. There are associations or risk factors. For instance, we think, is there maybe a link between the oral contraceptive pill? Is there a link between certain diets that people follow? Is there a link between certain medications? For instance, taking antibiotics early in life. You know, especially when you're a baby and young and your doctor prescribes antibiotics, usually unnecessarily. Is there some sort of link with that? Smoking is always an interesting thing. Smoking actually seems to be protective against ulcerative colitis, but if you smoke, you may get Crohn's disease, which is the other one. So it's neither here nor there.
So in other words, just don't smoke.
Just don't smoke.
Just don't smoke. Okay.
Absolutely. So that's why we are not absolutely sure in terms of just one single thing, and there's usually an association.
So there are those factors that may contribute to ulcerative colitis. So you mentioned the oral contraceptive, but you see, women now again, because how many women are actually on the oral contraceptive?
Absolutely. So we are not going to be at the point where we say, please do not take the pill, otherwise you will get ulcerative colitis. When we see somebody with ulcerative colitis and we go back in their history, then there's some sort of commonality that may prevail. But again, it's mostly an autoimmune thing.
Sure.
So in other words, something goes wrong in your immune system, and that we cannot predict, you cannot prevent until it happens or we see it.
Okay, so when we're looking at the ways of treating it and how to manage, because it sounds like it's a manageable chronic disease as opposed to one that you get a cure for. How then do you guys manage it?
Okay, so there's different approaches. Number one, there's the medication. All right, so because it's characterized by inflammation, we use anti-inflammatories to suppress them. Because there's chronic activation of your immune system, we use immune suppressants, so medication that can slow down or quieten down your immune system. We use courses of high-dose corticosteroids, steroid drugs, These are in safe drugs that are used in high doses for short periods of time just to settle that inflammation when there's a flare-up. And those are the main things. So it's anti-inflammatories, immune suppressants, and then corticosteroids. And then for flare-up, sometimes you may need anti-diarrheals to stop the diarrhea. You may need some suppositories and sometimes some antibiotics as well. Okay,
before we go into the symptoms, so in other words, how do I know that I may possibly have ulcerative colitis? Let's go into the issue of, can I live the normal life? And the reason why I ask this is because a lot of people are afraid of seeing the doctor because we're afraid of getting bad news, right? And they're afraid of the process that may be involved in terms of managing whichever illness or disease or virus that they may have. So settle us here, Doc. If I come to you guys and I say, listen, I suspect I might have this, how do I approach it? Where do you guys start?
Okay, so if you suspect, and a lot of patients use Dr. Google, so if they have some symptoms, they punch it in and it comes up, and you come to us and you say, look, I suspect that I may have an inflammatory bowel disease, I think I have ulcerative colitis. Yeah. We sit down and we take what we call a detailed history. So we go through all your symptoms. And if the symptoms are pointing in that direction, then we will explain what you may have. I will then examine you, and then we say, look, we need to do a series of tests. Don't jump to conclusions yet. Don't be overly anxious. Let's first make sure that what you think you have, you do have. Yeah. And then we usually refer you to a gastroenterologist. And the standard diagnostic test is a colonoscopy. So this is where we insert a probe, and this is where anxiety levels start to increase. All right, we prepare your bowel.
You know, you say colonoscopy, and I'm thinking, aren't you supposed to be over the age of 40 to get even a colonoscopy?
Well, it depends. See, yes, if you're looking for colon cancer, absolutely. But if you are suspecting, and this is younger people, so if you are suspecting an inflammatory bowel condition, unfortunately, then you have to have it.
So you take us through a series of tests, and obviously you'd refer us to a specialist so that we can actually rule out any or sort of effects, and then you manage it.
Yeah. Okay. So once a diagnosis is made and confirmed, then we start you on the course of treatment, which would involve now the anti-inflammatories, immune suppressants, and even there's fancy treatment called biologics, which also alter the course of the disease and keep it under control as well.
Symptoms.
Symptoms. Abdominal pain. Rectal bleeding is very important.
So abdominal pain.
Now, abdominal pain, remember, can be a whole host of things.
You see what I'm saying?
That is why it's things that go together, Faith, as opposed to just pain. Remember, the other very common condition, abdominal condition that we get is IBS, irritable bowel syndrome. This is IBD, inflammatory bowel disease. Two completely different things. One not serious, one very serious, or much more serious.
The bowel syndrome is not
IBS, that's spastic colon. That's yeah. So you get bloating, cramps.
Even rectal bleeding, isn't it?
Unless you have hemorrhoids.
Okay, gotcha.
But the condition itself does not cause rectal bleeding.
Okay.
Blood is always serious. Blood should not come out of your back passage, and the moment you see it, it is always serious, and you must see a doctor. So it's a combination of pain, rectal bleeding.
Unbearable pain, I can imagine.
Well, it's severe pain, yes.
Severe pain, okay.
Abdominal pain, rectal bleeding, and diarrhea. And this is
all at once.
Profuse watery stool, usually together. So not just one or the other. It's those classic triad. And then, of course, with that, you can lose weight, you can become fatigued. Remember, you're also losing nutrients through the colon, so you may become anemic, weak, fatigued, and ill, and sometimes can even affect other parts of your body as well.
Sure. So obviously when we're looking at that, and one, you know, Dr. Marlin, when it comes to us discussing these sorts of diseases, my first thought is, shucks, if anybody's got it, it's expensive. It's an expensive exercise, especially when it comes to treatment. So how do we make it easy for people?
Okay, so look, in the state sector, we have top doctors, we have investigative means.
Yeah.
So patients who are uninsured or not on medical aid, by being referred to any of the state hospitals, they will have access to all the diagnostic modalities, so you can make the diagnosis, and they can get access to the treatment. In the private sector, if one is on medical aid, it's what we call a PMB condition, right? So it's a prescribed minimum benefit. So it's legislated that one is able to receive this medication on chronic. Yeah. So once it's diagnosed, you apply for chronic on the medical aid, and the medical aid will pay for the medication every month, whether you have savings or not.